Aster Center of Excellence for Nephrology and Urology is one of the jewels in our crown. I say that consciously because of the depth in which we have built our human resources, our infrastructure and quality systems. Nephrology, for example, not just adult and pediatric nephrology. At this stage, we are a young institution, but we have 4 consultant nephrologists who can take care of the entire spectrum of renal diseases as we know it, right from hemodialysis, peritoneal dialysis. You have patients on end-stage renal diseases who are being managed so beautifully by this team. You can imagine this kind of care being provided in both an NABH accredited and a Joint Commission accredited facility. The clinical outcomes are on par with the best in the world. When we look at urology, this center is very unique, not just for the regular kind of endourology work or laparoscopic urology work, but even from an ambulatory care point of view. We have all possible equipments, right from an ESWL for your stone issues. We have an ambulatory cystoscopy unit. We have a very good urodynamic facility in the ambulatory care setup. The team here are doing pioneering work using the Da Vinci surgical robot, which has provided that required cutting edge in terms of clinical acumen. Recently, we had captured a national headline to be the 3rd center in the world to perform a very rare transvaginal renal transplant using the Da Vinci surgical robot. Such is the quality of talent available in the Aster Center for Nephrology and Urology.
Let me talk to you about an 83-year-old gentleman I saw this morning. He has been under my care for the last 14 years and at Aster City now for almost close to 3 years. 14 years ago, at the age of 69, he was diagnosed to have permanent loss of kidney function, kidney failure. Hearing the diagnosis, his family and friends were shattered. But this gentleman had a very strong will. He came and asked me, "What should I do, doctor?" I said, "The answer for you would be to start on dialysis." He has been on dialysis for the last 14 years. He has led a very disciplined life and he has a very strong will. He was taken care of in a unit which had a good team, including doctors, nurses and technicians. As a result of this, he has had a fantastic quality of life. He has a normal social life. He still walks on his treadmill every day. He attends all meetings and he has been extremely happy. So this is the result of someone who has a strong will with a very good, strong discipline, supported by a good team of medical professionals.
This gentleman actually, he was in mid-50s. He's a wealthy businessman in Middle East. He was on the way to the Nirmasheri airport here to see off his son. Actually, he was graduating soon from a university in US. So he's about to send his son for that final graduation ceremony. And in between, he developed some blood in urine. So he thought like, I should drop here, it's a world-class hospital here. So he just came to an emergency. And then the emergency doctor evaluated him and scans were done one by one. And to the greatest of surprise, there was a big renal tumor sitting there in the abdomen, and it was really big, and it was invading into one of the major blood vessels which supplies the heart, called inferior vena cava. So even we was stunned because he didn't have any symptoms as such. He wanted some time to think about it, and he had this very important family function because he's very attached to his children and he wanted to somehow attend the ceremony back there in US. Then he's a pretty quite smart guy, well aware of the modern science. He investigated all over the world. Correspondence was done with universities in US, and eventually he came back to me, "Doctor, can you do a robotic surgery on this for me?" So I thought about it. Okay, I had suggested an open surgery initially about him because this surgery is a major surgery and there are only hardly few reports across the world where robotic surgery has been done for such a big tumor which is kind of involving the inferior vena cava. So I told him, "You'll be the first person that I'll be doing, and probably you'll be the first person in India also to do that because nobody else has done this procedure in India and you have to think twice about it." So he said, "I have complete faith in you. you can go ahead. My main aim is to go ahead and attend the ceremony, because if you're doing an open surgery, probably it will take around 6 months to recover completely and get back to him, because we make a very large incision in the abdomen and the recovery is so slow and painful, so we don't want to do that. So with the patient having complete faith in us, what we did was we embarked on a robotic surgery, and we went very carefully because this was an uncharted territory for us, and we completed the surgery really successfully without much blood loss, and the patient was very happy, left the hospital after a week or so, and eventually 1 month later he could attend the graduation ceremony of his kid, and he was very happy. And God willing, he's still alive with no evidence of cancer, and does the constant follow-ups with me, and is a very happy person.
I am narrating a story of a 12-year-old girl who was walking across a railway track along with her relatives after attending a family function when she was bitten by a viper snake. She was taken to 2 different hospitals and given appropriate doses of anti-snake venom, but her condition deteriorated after a duration of 48 hours when she was brought to our hospital by a group of doctors in mobile ICU. On presentation here, she was very sick. Her blood pressures were low. She was drowsy. She was bleeding from all orifices, including nose, gums, and there was blood in the urine as well. Her condition further deteriorated next day, wherein her urine output dropped, kidney functions deteriorated, and sensorium worsened, and she had to be put on ventilator. She was bitten by a rare variety of snake seen in this part of the country, which does not respond to anti-snake venom as seen in this case. So we decided to consider a special form of treatment called as plasmapheresis in her, in which we remove the plasma from the patient which contains poisons and antibodies as a result of snake bite and replace it with a fresh plasma. She underwent 6 sessions of plasmapheresis and 12 sessions of hemodialysis during her 1 month hospital stay, after which she completely recovered. Her bitten leg was pretty bad on presentation, which had a lot of blisters and necrosis, which we surgically debrided and placed a new skin graft at the time of discharge. She went home happily, cleared her 9th exams. Presently she is in her 10th, doing well in her academics, with the aspiration of becoming a doctor in the future. 2 points I would like to emphasize in this case. One is, this girl had a kidney failure which was temporary in nature. If identified early and treated promptly, can regain her kidney functions completely. Second point is the importance of team effort, which included group of doctors, nursing staff, other supportive staff, and the persistent belief and commitment from the parents and support from the community as a whole, which included moral as well as financial support, really did wonders in this girl.
This is a story of a 65-year-old gentleman who came to us with difficulty in passing urine. He could not pass a drop of urine, and he was in pain and distress. He was even more distressed when we told him that we could not place a tube into the bladder to drain the urine. So we had to put a tube into the lower part of the abdomen, directly into the bladder to drain the urine. After that, we had to investigate him, and it was found that his entire urethra was very bad, irregular and narrow, not even admitting a 6 French feeding tube. This situation leaves us with the option of reconstructing the urethra with different tissue taken from the other parts of the body. And this procedure is called substitution urethroplasty. Usually this substitution is done using a skin taken from the inner part of the cheek, that is called the buccal mucosa. This procedure is done with the help of 2 teams, and the buccal mucosa is harvested with the help of facial surgeon, who takes the strips of mucosa from the inner part of the cheek and gives it to the urologist, who dissects the urethra and lays it over the incised urethra over a catheter. This will widen the urethra and keep the lumen patent so that he can pass the urine normally. This procedure has a success rate of 90 to 95% without any major complications. This is the only option in desperate situations like this, where the entire urethra is diseased and narrow. He was on a Foley's catheter for 2 weeks, and after the 2 weeks, we removed the catheter, and he was so happy that he could pass urine normally as before.
Tasneem is a 21-year-old girl who developed edema at 8 months of pregnancy. She was found to have rapidly worsening renal functions, following which her pregnancy had to be terminated. She was delivered of a healthy child but underweight at 8 months. After that, she was found to have even worsening renal functions and she required hemodialysis support to sustain her life. She was stabilized with hemodialysis and she underwent a kidney biopsy for diagnostic purpose. The kidney biopsy revealed she had SLE or systemic lupus erythematosus. SLE is an autoimmune disease where the body defense mechanisms or defense system against foreign bacteria and viruses start attacking the body tissues itself. In SLE, the kidney is a major target of these mechanisms and due to which kidney failure occurs. She was treated with specific medicines for her condition and gradually she made a very good recovery. She is presently not on dialysis support and leads an active and healthy life and looking after her healthy baby.